relationships evolve over multiple generations, influencing present-day families through inherited behaviors, values, and expectations. These methods examine patterns that are passed down, shaping individual roles and interactions within the family unit. This section discusses Murray Bowen's natural systems theory, which emphasizes the importance of multi-generational emotional systems. And Ivan Bozormeny-Nagay's, contextual therapy, which focuses on ethical reciprocity and family loyalty. Together, these perspectives provide valuable insights into how family history impacts current functioning and relationships. Bowen's natural systems theory highlights the importance of predictable forces such as individuality and togetherness that influence human behaviors and relationships. This theory emphasizes the connection between family anxiety levels and individual differentiation. According to this perspective, all families experience some degree of emotional system disturbance, which results from the ongoing interplay between anxiety and differentiation. Families with low levels of differentiation tend to be more reactive to even minor stressors. They require less external or internal anxiety to develop symptoms such as depression, anxiety, or addictive behaviors such as alcoholism. Conversely, families with higher levels of differentiation are better able to manage stress internally and usually only exhibit symptoms when faced with significant or prolonged stressors. Importantly, Bowen suggests that regardless of a family's level of differentiation, sustained high anxiety, whether chronic or situational, can lead to the emergence of various symptoms. For example, alcoholism is viewed as a manifestation of underlying family anxiety, serving as a maladaptive coping mechanism. Overall, Bowen's theory provides insight into how family dynamics influence individual mental health and behavioral patterns. Bowen's theory emphasizes that an individual's current functioning is closely linked to their ancestors' experiences and will also be connected to future generations. This interconnectedness is due to the multi-generational transmission process, in which relational dynamics, behavioral and emotional patterns, and differentiation levels are all transmitted through the generations. This transmission occurs both consciously and unconsciously, and it impacts these patterns on an individual level. In this context, the counselor serves as a coach, guiding family members to understand their reactions within the family dynamic. By encouraging individuals to adopt an I position, the therapist aims to enhance each person's differentiation. Greater differentiation enables individuals to interact with other family members more calmly and objectively. This process often involves creating a genogram and discussing the recurring family patterns across generations. The contextual therapy approach emphasizes the impact of multi-generational legacies and ethical considerations within family relationships. The principles of fairness, justice, restoration, and trust play key roles in this approach. There are 5 dimensions. Contextual therapy examines relationships through facts, which includes family history and structure, individual psychology, which refers to thoughts and feelings, systemic transactions or family dynamics, relational ethics pertaining to fairness and loyalty, and the ontic dimension, which highlights how relationships influence our sense of self. Invisible loyalties refers to the covert loyalties and obligations handed down through generations, which can profoundly impact behavior and dynamics. Multi-generational transmission refers to the way patterns of equity, injustice, and trauma are conveyed and propagated through generations, often unconsciously. Parentification and destructive entitlement refers to the phenomenon wherein children are compelled to take on adult roles or act out injustices when relational balances are destabilized. A core strength of this approach lies in its holistic lens. Rather than isolating the individual as the sole locus of pathology, the intergenerational approach contextualizes substance use within broader patterns of familiar relationships and inherited narratives. Therapeutic interventions often involve constructing family genograms, exploring family of origin narratives, and working to disrupt cycles of dysfunction, such as codependency or enabling behaviors. Excuse me, sorry, I've been sick. However, the approach has its limitations. Some critics argue that focusing too intently on the past may risk pathologizing families or inadvertently assigning blame for present struggles. Additionally, this method can sometimes neglect the immediate social, economic, or structural factors that contribute to substance use, privileging psychological and relational explanations over systemic ones. Applying intergenerational approaches in multicultural settings necessitates cultural humility, recognizing the diverse perspectives shaped by moral, religious, and societal norms. Attitudes towards substance use, mental health, and help-seeking behaviors differ significantly across cultures and generations. Embracing this diversity fosters trust and open communication, enabling more effective support and intervention strategies that respect each individual's unique cultural background and expectations. The diversity of family structures, which can include blended, chosen, extended nuclear, and single-parent families, requires mental health professionals to utilize the intergenerational approach with cultural humility and flexibility. There is no one-size-fits-all framework. Counselors must conscientiously assess which individuals are considered part of the family, existing roles and support systems, and the dynamics that influence and drive patterns of substance use across generations. Extended households, for example, play a significant role in shaping family values and fostering resilience, providing a strong support system and shared traditions that reinforce bonds. Conversely, blended families often encounter challenges in communication and shifting alliances and roles that can create misunderstandings and tension. Single-parent, adoptive, and foster families each bring unique strengths, such as deep individual bonds and adaptability, but also face stressors like increased responsibilities and ongoing identity questions. These dynamics influence family stability, requiring patience and open dialogue to navigate complexities and build cohesive, supportive family units. A multicultural perspective emphasizes how migration, trauma, and acculturation stresses significantly impact intergenerational substance use. Displacement, loss, and historical trauma deeply shape family dynamics, often leading to patterns of substance misuse passed down through generations. Recognizing these interconnected factors is essential to understanding the complex experiences of diverse communities, highlighting the importance of culturally sensitive approaches to prevention and intervention that address underlying historical and social influences. A multicultural perspective emphasizes how migration, trauma, and acculturation significantly impact intergenerational substance use. Displacement, loss, and historical trauma deeply shape family dynamics, often leading to patterns of substance use passed down through generations. Recognizing these interconnected factors is essential to understanding the complex experiences of diverse communities, highlighting the importance of culturally sensitive approaches to prevention and intervention that address underlying historical and social influences. In summary, the intergenerational approach offers meaningful insights into the roots of family substance use, highlighting how patterns of behaviors are passed down through generations. However, its effectiveness relies heavily on deep cultural understanding, respecting family strengths, and thoughtfully addressing unique challenges. Experiential family therapies, rooted in a dynamic and engaging approach, emphasize the importance of in-session interactions among family members. By encouraging participants to openly connect with their own feelings and to understand others' experiences, these therapies promote genuine communication. Centered on the present moment, they also explore how past influences shape current behaviors and relationships. This focus fosters heightened awareness, helping family members gain deeper insights into themselves and each other, ultimately strengthening bonds and enhancing emotional understanding within the family unit. The guiding principles of the experiential approach are the here and now focus, authentic emotional expression, process over content, creative engagement, and a holistic view. The here and now focus prioritizes the feelings, dynamics, sensations, and occurrences of the past over analyzing the past or planning for the distant future. Clients are encouraged to express authentic, complex emotions such as anger, fear, grief, and love, regardless of how unfamiliar or uncomfortable they may feel about them. Process over content refers to the process of interacting rather than the specifics of each individual's personal story. In this context, the manner in which family members communicate and relate to one another is just as important as the content of their conversations. The principle of creative engagement pertains to activities, art, movements, role-playing, and other creative modalities that can be utilized to help clients express those emotions that might otherwise be difficult to articulate. Through a holistic view, each person sees within the context of the family system. The family as a unit is seen as competent and capable of positive change and growth. The strength of this approach is that it encourages deep emotional engagement and allows family members to connect with one another beyond surface-level conversations. It also fosters authentic interactions and genuine connection to help families break entrenched patterns and cultivate empathy. It promotes resilience and healing by involving families in interactive activities such as art, role play, and movement, and it can be integrated with other therapeutic models such as structural, CBT, and systemic approaches, which offers a versatile approach that can be tailored to family needs. The limitations of this approach is that it might be challenging for families who are uncomfortable with emotional expression or experiential activities. It requires a skilled counselor who can manage and facilitate intense emotions or resistance that may arise during sessions. Additionally, some issues may benefit from more structured or cognitively focused interventions, which experiential methods alone may not fully address. Therapists play a vital role in guiding clients through emotional exploration, ensuring that cultural traditions are honored and integrated into the process. They should adapt therapeutic activities to align with clients' cultural backgrounds, utilizing meaningful symbols and practices that resonate. Collaborating with community leaders can enhance trust and relevance. Additionally, therapists must engage in ongoing education to reflect on and address their own biases, fostering culturally sensitive and effective support. The effectiveness of the experiential approach can vary significantly in multicultural settings because of diverse cultural norms surrounding family relationships, communication styles, perceptions of authority, and emotional expression. These differences may lead participants to feel uncomfortable or resistant as unfamiliar practices challenge their cultural expectations. Such discomfort can hinder active engagement, limit openness, and reduce the overall impact of the approach. Therefore, practitioners must adapt their methods thoughtfully to accommodate varying cultural perspectives and foster a more inclusive, effective experience. Cultural beliefs about addiction significantly influence approaches to therapy, making sensitivity and humility essential for effective treatment. Additionally, language barriers and differing nonverbal cues further complicate the process, requiring clinicians to adapt their communication styles carefully. Understanding these factors is crucial for successful culturally competent care. In summary, culturally responsive experiential therapy assists diverse families in articulating their unique patterns and experiences. By fostering a safe, respectful environment, it promotes healing through genuine presence, understanding, and cultural affirmation, empowering families to build resilience and strengthen their bonds authentically.
In this section, we will be covering communication and strategic approaches to family counseling for substance use and addiction, Mental Research Institute Brief Therapy, or MRI Brief Therapy, is an intervention or approach to therapy that falls under the communication approaches to family counseling, and it's a problem-focused approach that is rooted in cybernetic and systems or systemic theories and principles to counseling. It views problem behaviors as being rooted in the family or the individual's responses to difficult situations as opposed to the circumstances themselves. An intervention or a technique used under this model is reframing. It is a technique that focuses on changing or reframing, again, the meaning associated with behaviors or situations. The therapist will essentially provide alternative examples or interpretations of scenarios to help shift the behaviors and the thinking patterns of their client. The therapist may encourage the spouse of a substance abusing individual to reframe their thinking about the substance in regards to how they perceive that substance. Like, if they were to think that their spouse is choosing that substance over them, or they are doing the substance because they don't love them, the therapist would encourage them to rethink, like, maybe that person is doing it as a cry for help or a means of self-medicating, something along those lines. Another technique used under this intervention is referred to as benevolent sabotage. It is a technique that aims to disrupt ineffective or unhealthy patterns of behavior in order to promote healthier functioning or desired behaviors. So I have a couple of examples for this. The one that I had put in one of my discussions was a family with an adolescent child. If they were trying to bring about acts of like independence, maybe they wanted the child to start picking out their own outfits for school, or cooking their own meals, or waking up on time without the aid of the parent. The parent may, make a meal that they know that the child won't like to encourage that act of independence from them, or pick out an undesirable outfit to encourage them to, choose their own outfits or to set their own alarms. The one that I have here specifically for substance use and addiction is if the therapist wanted to change an undesirable behavior around control or monitoring in the spouse of an individual with substance abuse issues, they would encourage them. It's essentially it's a little bit sarcastic, because they would encourage them to do more of that undesirable activity. Like, oh, why don't you go through their belongings more frequently? I bet that would increase the levels of trust and love in your relationship. It's essentially like highlighting that problem behavior to help the individual see the ineffectiveness or the way that behavior is unhealthy and unhelpful to the situation. A few strengths to this approach. The first one that I have down is that it does follow a systemic perspective or outlook on family counseling. It recognizes the importance of the entire family system in the treatment process, as opposed to just the individual experiencing the substance abuse or addiction. The second one that I have is that it improves communication and conflict resolution among the family. It helps family members learn healthier ways of communicating, setting boundaries, and resolving conflict. And then the last one is that it increases family involvement. It does engage the entire family in the recovery process, so it inevitably involves, the entire family, and then it's more beneficial for long-term change. A couple of limitations to this approach is that it does there is a potential to overlook individual pathologies because it does focus a lot on the family system. There is a potential to neglect the individual behavioral, psychological, or biological factors that contribute to their addiction. And then the second one is that it requires family willingness, and sometimes families might be resistant or unable to engage in the treatment process due to past traumas or conflict. A few multicultural implications to these approaches is that it's important that therapists don't impose Western norms on their clients, as there are differences in communication styles between different cultures, and the therapist has to have a level of cultural humility and awareness to address any potential language barriers that may arise due to these discrepancies. Additionally, family roles and hierarchies are more valued and enforced in some cultures, so it's important to be aware of this as well, just to navigate those differences in a way that is respectful to the family's culture. Now we're moving on to the strategic approaches to family counseling, specifically brief strategic family therapy. This approach focuses on changing dysfunctional structures by targeting unhealthy patterns of interaction. The strategic therapist, I have a quote here from the textbook. The strategic therapist is less interested in the past and more focused on the present. Problems are occurring in the family not because they've happened in the past, but because they are continuing to happen. They are repetitive behavioral sequences that involve more than one person and are maintained by people's continued actions. Intervention or technique that is used under this intervention is referred to as directives, and these are instructions prescribed to the family by the therapist to change the behaviors among the family, establish the therapeutic relationship between the client and the therapist, and to obtain more information regarding family dynamics to just further supplement the intervention process. A few strengths to this approach are that it is direct and goal-oriented. It has very clear goals that are measurable and practical. Second strength to this approach is that it is efficient and brief. These interventions are short-term and goal-oriented, so that this makes this intervention ideal for families experiencing crises. And then the last strength that I have is that it disrupts maladaptive patterns. This approach targets how family behaviors may negatively contribute to addiction, behaviors like enabling and scapegoating, and it doesn't require a lot of emotional disclosure. A limitation to this approach is that, again, it is very structure focused. This approach focuses on reducing or eliminating the symptoms that are occurring because of the structural makeup of the family, as opposed to addressing the potential underlying emotional or relational problems that may be contributing to the conflict. And some multicultural implications to this approach are that it is important when using this approach, it's important that therapists are aware that because they are directing the clients, conflict may arise in the family system in terms of like some cultures value family roles, maybe patriarchal kind of roles, power dynamics more than we do. So role-playing scenarios that maybe Americans are more comfortable with, other countries may experience, or other cultures may experience friction with challenging those dynamics. So it's important that there is a clear understanding of the intervention to ensure that the therapist doesn't unintentionally disrespect or dishonor the culture of their client.
Hi everybody, my name is Mackenzie. I'm going to be discussing narrative therapy, which is a postmodern and systemic counseling approach that separates the individual from their problems and will explore how it can be applied in substance use treatment when working with families. This therapy is based on the idea that people make meaning through the stories they tell, and substance use becomes part of the problem story, but it's not the person's identity, and therapists explore how the problem has influenced them and how they revisit it. It's been founded by Michael White and David Epson. The goal is to help families reauthor their narrative by externalizing the problem, mapping the influence with the unique outcomes, and reauthorizing conversations. In this practice, therapy helps families shift the blame off of one person instead see the problem, like addiction, as something they can tackle together. It highlights how they've already made their progress in small ways, and it creates a space for hope and accountability. For this therapy, there are some multicultural implications. For the strength, it avoids stigma, it's flexible across cultural stories, it honors family values. It aligns well with this because it doesn't impose a right way to heal, and it respects the culture-specific narratives. However, it may not address the trauma or international pain deeply, and the language of storytelling may vary by its culture. And because of this, families may be reluctant to speak openly and prefer more directive methods versus this. Strengths and limitations. The strengths are empowering collaborative, respects multiple realities, less pathologization. I can't say that word. I'm so sorry. It gives families hope by focusing on their strengths. However, some families want it to be more direct or practical strategies, especially in the crisis, and it doesn't focus on the biology of the addiction, and it will require a strong creativity by the therapist. To wrap up, native therapy is an empowering approach that sees families as capable of change. However, it's not going to work for every family because it's not a one-size-fits-all. But when it's used thoughtfully and how it's supposed to, it can transfer how families view the problem in themselves. And it will also help them reframe blame and shame. And that is my presentation for you guys for postmodern systemic with a focus on narrative therapy.